Another difficult decision made recently by Niagara Health to temporarily close Fort Erie's Urgent Care Center on January 4th didn't sit well with some local politicians. Wayne Redekop is the mayor of Fort Erie. Wayne, were you consulted on this move before it was made?
We weren't consulted with respect to the decision. We were given a heads up by President Lynn Guerrero prior to the decision being implemented, which is at least a step forward for Niagara Health. In the past, they usually make the decision, implement the decision, and then say, oh, by the way. So I appreciated that, but the reality is we weren't consulted and really had no input into the decision, weren't able to provide some of the perspectives that we could have brought to the table, which may have influenced the thinking. So we've made it very clear to Niagara Health that the decision itself is not acceptable and the way it was reached is not acceptable. But we are where we are, so now we're going to try to work moving forward to make sure that the urgent care center is opened as quickly as possible, so that the residents of Fort Erie have the care that they need.
You use the term perspectives. What are some of the perspectives? Why was it important for you to not have the urgent care center closed?
Well, the reality is it's a growing community, and we have a mix of not only seniors who are moving into the town, as you know, but we also have a lot of young people moving into Fort Erie with families, and those are people that are reliant upon accessibility of healthcare and hospital care. Fort Erie is somewhat isolated from the other municipalities in Niagara. As you know, at one time we did have a full service hospital in Fort Erie, unlike many of the other communities, but others are closer to hospital facilities. The one real significant issue, which is in the winter, the weather. And, you know, when we have a storm, and ironically, the day that the urgent care center here was closed, we had a snowstorm. It's very difficult for people to travel on the Queen Elizabeth Highway or on Garrison Road, Highway 3, between Fort Erie and Niagara Falls, or Fort Erie and Port Colborne. So that's always been a big issue. And the reality is that there's lots of space in Fort Erie. There's an adequate area for the urgent care. There's a potential for diagnostics as well. The nurses that were there are very experienced. I know that that's one of the reasons that they chose Fort Erie over Port Colborne, was because we had a larger number of very experienced nurses and support staff, and so they could be redeployed to the emergency departments, which are short-staffed. Niagara Health is in a very difficult situation with the number of nurses and support staff who are off work because of COVID-19 or the need to isolate, and because of the significant number of hospitalizations now arising out of this Omicron variant, which has spread like wildfire through North America, really. So we understand that, but we think that there could have been other avenues that could have been considered, and you don't know that unless there is consultation.
Your local MPP, Wayne Gates, was very vocal in support of your point of view. He wanted to bring the military in, almost sounding a little like Mel Lastman back in, I think it was 1998, in the city of Toronto. Do you think that was a necessary step?
When you've got large populations that are under stress and have their health care in jeopardy, you look at all the options. And organizations which take pride in the work that they do and the service that they provide, they don't like to acknowledge necessarily that they're in a dire situation, and certainly requesting the military would be the ultimate acknowledgement of weakness. But you have to set that aside when you're talking about people's care. You have to set aside any pride that you might take in your organization, and so I think that's an extreme remedy. But I think you have to look at all the options. So Wayne Gates has been very, very good. We spent a lot of time talking through this situation, and we're essentially in lockstep with the solutions which we want, which is an immediate return of our urgent care center in Fort Erie once the safety issues have been dealt with in the region. And then we're going to look at what additional things we might be able to do with Niagara Health.